And this is a quote from Professor Rasjid Skinner about the importance of careful formulation. So when we're gathering information about somebody, or even if somebody's as an imam or as a teacher, a child's coming to you and is talking about a problem, unless you look into that problem in a bit more detail, you might not get to the bottom of it. And sometimes if you just go by rules of thumb, or you might just go by your clinical training and you're not inquisitive enough, and you're not using your clinical training more widely and holistically, you might actually miss the important factor. So in this quote, the Professor Skinner mentions there are different types of depression: biological, to be treated by a clinical doctor; trauma-induced depression, to be treated by a psychologist, for example. And then there is one that is a state of repentance, and that is not depression at all. It is gold dust and valuable. So sometimes when somebody's going through that process of grief, that person might be going through a natural process of repentance, and it might not be, and it might be contraindicated to then zonk that natural process with an antidepressant, or even to treat it from a psychological perspective. So some person going through a difficulty, it might be a state of repentance, and then that repentance is really important for that person to move on. And we just need to support that person, validate their feelings, and give them hope and support and move them through.